Welcome back to From Fear to Fun, the podcast where we explore how to transform medical encounters with children from moments of fear into opportunities for fun, with connection, confidence and cooperation. I'm so glad that you are here. Last time we looked at the importance of change for any medical treatment. Today's episode looks at one tool that we need to use to bring the change about: persuasive communication. Not manipulation, not pressure, but the art of helping children and parents move from helplessness to empowerment, from passive recipient to active partners, from fear to change. Persuasion is often misunderstood, but at its core it simply means influencing beliefs, attitudes, intentions, motivations, behavior. The American Psychological Association describes persuasive communication as information intended to change or strengthen a person's attitude or course of action. In other words, any communication that aims to do more than entertain has persuasive elements. And in medicine, almost everything we say aims to change something. As we have seen, every treatment requires change. Sometimes the patient or parent needs to start something, like taking medicine, altering a diet, beginning an exercise, or adopting a new routine. And in contrast, sometimes they need to stop something, reducing sweets or fizzy drinks, avoiding cotton buds, and stopping harmful behavior. Persuasion is the bridge between intention and action. But persuasion is not about pushing, it is about guiding. It is about shifting the patient's concept of themselves from helpless recipient to empowered partner. Change is hard because the old routine pulls us back. New behaviors require conscious effort, energy, patience, and the benefits rarely appear immediately. This is why long-term adherence to treatment plans is often as low as 30%. Not because the patient don't care, but because change is exhausting, slow, and unfamiliar. Persuasive communication helps patients staying motivated through this difficult transition. Let's have a look at the traditional dynamic. The usual pattern looks like this. There is a health problem. The parent and child realize they can't solve it alone. They seek our professional help. And then? We often behave like teachers, scolding students for not knowing the answer. We act, they hold still. We prescribe, they wait for us to fix it. But many conditions, obesity, addiction, anger management, lifestyle-related issues, cannot be fixed by us alone. The patient must participate. And participation requires persuasion. Change fails when the patient waits for us to improve things. This passive stance works for removing a splinter, but not for long-term behavioral change. To activate the patient and parent as partners, we need persuasive communication that respects their competence, acknowledges their lived experience, recognizes their obstacles, and last not least invites them into the process. They know their life better than we do. They know what will work and what won't. Our job is not to impose a plan. Our job is to co-create one. Empowerment begins with two questions. Are we willing to invest in their understanding? And are we willing to empower them as partners? Even a child as patient. This might require a shift in mindset. We must move from "I fix you" to we solve this together. From doctor as main actor to doctor as guide. From patient as passive to patient as capable. When we use persuasive communication well, we help families understand the mechanics of their condition and discover their own strategies for change. This is how we shift them from helpless recipients to empowered partners. In a nutshell, persuasive communication is one important tool to initiate change. Every treatment requires change, either starting something or stopping something. Change is hard because old routines pull us back and benefits take time. Patients often remain passive unless we actively empower them. Persuasive communication helps shift patients from recipient to partners. Our role is to guide, support, and co-create a plan, not simply to instruct. This is how we empower children and parents to step into their own agency and how we move from resistance to cooperation, from helplessness to empowerment, and from fear to fun.